A patient is scheduled for a fasting blood glucose test but reports drinking coffee with sugar before arrival. What should the medical assistant do? A. Proceed with the test as ordered. B. Reschedule the test for another day. C. Draw the sample but note the intake. D. Inform the provider before proceeding. Answer: D. A medical assistant should not proceed without provider input since the intake of sugar can alter results. The provider must decide whether to continue, cancel, or reschedule the test. When preparing an intramuscular injection for an adult, the correct angle of insertion is A. 10 to 15 degrees. B. 45 degrees. C. 72 to 90 degrees. D. 30 degrees. Answer: C. Intramuscular injections require a 72 to 90 degree angle to ensure medication reaches deep muscle tissue. A patient expresses fear of needles before a venipuncture. The medical assistant's best response is A. Don't worry, it won't hurt at all. B. It's normal to be nervous, let's take a few deep breaths. C. You have to stay still or I can't do it. D. Just look away and relax. Answer: B. Acknowledging the patient's concern and offering coping techniques demonstrates empathy and professionalism. Which of the following is a sterile field violation? A. Opening instruments away from the sterile field. B. Keeping hands above the waist. C. Turning your back on the sterile field. D. Using sterile gloves during setup. Answer: C. A sterile field must always remain in sight, turning away risks contamination. A patient receiving nebulizer treatment begins to experience dizziness. What should the medical assistant do first? A. Call 911 immediately. B. Stop the treatment and notify the provider. C. Tell the patient to continue. D. Check blood pressure before deciding. Answer: B. Dizziness can indicate adverse reaction. The first step is to stop the treatment and alert the provider. When collecting a throat culture, the swab should be applied to A. The tongue surface. B. The roof of the mouth. C. Inflamed areas of the tonsils and pharynx. D. The inside of the cheek. Answer: C. Accurate results require contact with affected tissue, avoiding contamination from tongue and cheeks. Which pulse site is most appropriate for routine vital sign assessment in adults? A. Radial. B. Brachial. C. Carotid. D. Apical. Answer: A. The radial pulse is the most commonly used site for adults in clinical practice. Which action reduces the risk of iatrogenic infection during wound care? A. Reusing sterile gauze. B. Using clean gloves instead of sterile. C. Strict adherence to aseptic technique. D. Applying dressings without hand hygiene. Answer: C. Iatrogenic infections are caused by medical procedures. Aseptic technique prevents them. A patient with suspected orthostatic hypotension requires blood pressure measurement in which order? A. Sitting, standing, lying down. B. Lying down, sitting, standing. C. Standing, lying down, sitting. D. Any order is acceptable. Answer: B. Start with supine, then sitting, then standing to observe changes in blood pressure. Which of the following laboratory tests requires the specimen to be protected from light? A. Potassium. B. Bilirubin. C. Sodium. D. Glucose. Answer: B. Bilirubin degrades when exposed to light, requiring protection to ensure accurate results. The correct needle gauge for adult venipuncture with evacuated tube system is typically A. 16 to 18, B. 19 to 20, C. 21 to 22, D. 25 to 27. Answer: C. 21 to 22 gauge is standard for most adult blood draws, balancing flow and patient comfort. Which of the following tasks can a medical assistant legally perform in most states? A. Prescribing medications. B. Administering injections as directed. C. Independently diagnosing. D. Changing controlled drug dosages. Answer: B. MAs can administer injections under provider orders, but cannot prescribe or diagnose. When performing ear irrigation, the solution should be at A. Cold temperature, B. Body temperature, C. Slightly hot, D. Any temperature available. Answer: B. Using body temperature solution prevents dizziness and vertigo during irrigation. Which laboratory value is considered critical and must be reported immediately? A. Fasting glucose 110 mg per deciliter. B. Sodium 138 milliequivalent/L. C. Hemoglobin 13g/dL. D. Potassium 6.5 milliequivalent/L. Answer: D. Elevated potassium levels can cause cardiac arrest, making it a critical finding. The primary purpose of documenting in a patient's chart is to A. Avoid malpractice claims, B. Provide accurate record of care, C. Meet billing requirements only, D. Comply with HIPAA. Answer: B. Documentation ensures continuity and accuracy of care, serving as a legal and medical record. What is the correct action if a patient refuses a procedure? A. Convince the patient forcefully. B. Ignore the refusal. C. Proceed anyway if ordered. D. Document the refusal and notify the provider. Answer: D. Respect for autonomy requires documenting refusal and informing the provider. Which instrument is used for a pap smear specimen collection? A. Otoscope, B. Vaginal speculum, C. Tonometer, D. Laryngoscope. Answer: B. A vaginal speculum is used to visualize the cervix for pap smear collection. Which body system is assessed with a Snellen chart? A. Cardiovascular, B. Respiratory, C. Integumentary, D. Visual. Answer: D. The Snellen chart measures visual acuity, part of the visual system assessment. A patient complains of chest pain while in the clinic. The MA's first response is to A. Get the provider immediately, B. Perform CPR, C. Record symptoms first, D. Offer water and reassurance. Answer: A. Chest pain is a medical emergency. The provider must be alerted right away. Which injection site is recommended for infants under 12 months? A. Gluteus maximus, B. Vastus lateralis, C. Deltoid, D. Abdomen. Answer: B. Vastus lateralis is safest for infants due to adequate muscle mass. The term asepsis refers to A. Complete elimination of all microorganisms, B. Absence of disease-causing organisms, C. Sterilization by heat, D. Resistance to infection. Answer: B. Asepsis means free from pathogenic microorganisms, achieved by clean or sterile technique. A capillary puncture is most appropriate for which patient? A. Adult requiring blood cultures. B. Patient on IV therapy needing glucose check. C. Newborn screening test. D. Patient needing multiple chemistry panels. Answer: C. Capillary puncture is commonly used for newborn screenings where small volume is needed. Which of the following is a CLIA-waived test a medical assistant may perform? A. Arterial blood gases. B. Urine pregnancy test. C. Tissue biopsy. D. Blood typing. Answer: B. Urine pregnancy tests are simple CLIA-waived tests permitted for MAs. The proper technique when cleansing a venipuncture site is: A. Wipe in circular motion, moving inward. B. Circular motion outward, then allow to dry. C. Random wiping until site is wet. D. Dab gently without drying. Answer: B. Outward circular motion removes contaminants, and the site must air dry for antiseptic effect. Which emergency position is used for a patient experiencing syncope? A. Supine with legs elevated. B. Sitting upright. C. Prone with head turned. D. Standing with arms raised. Answer: A. Supine with legs elevated promotes blood flow to the brain during fainting. Which is an example of subjective data in the patient's chart? A. Pulse 90 BPM. B. Patient reports dizziness. C. Blood pressure 110/70. D. Temperature 98.6 degrees Fahrenheit. Answer: B. Subjective data comes from the patient's perception, not measurable signs. Which blood collection tube is used for coagulation studies? A. Light blue top. B. Lavender top. C. Red top. D. Gray top. Answer: A. Light blue top tubes contain sodium citrate for coagulation testing. What is the main function of the tourniquet during venipuncture? A. Prevent bleeding. B. Increase blood pressure. C. Make veins more prominent. D. Stop blood flow completely. Answer: C. The tourniquet temporarily slows venous return, making veins easier to locate. Which injection route requires the longest needle? A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Intravenous. Answer: A. IM injections use longer needles to penetrate deep muscle tissue. When a patient's chart contains an error, the correct correction method is: A. Erase and rewrite. B. Use correction fluid. C. Draw a single line, initial, and date. D. Remove the page and replace. Answer: C. Legal documentation requires a single line through the error with initials and date to maintain accuracy. Which of the following is the most appropriate action when a patient refuses a prescribed treatment? A. Document the refusal in the chart and notify the provider. B. Attempt to administer the treatment regardless. C. Call the patient's insurance company. D. Discharge the patient immediately. Answer: A. A medical assistant must respect patient autonomy. Refusal must be documented, and the provider should be notified, but forcing care is a violation of rights. When collecting a wound culture, what is the first step before swabbing the site? A. Rinse with sterile water. B. Remove excess exudate with sterile gauze. C. Apply an antiseptic solution. D. Touch the swab to intact skin around the wound. Answer: B. Excess exudate should be removed to prevent contamination and ensure the culture reflects the actual wound pathogens, not surface debris. Which of the following injections requires the Z-track method? A. Insulin injection. B. Intradermal injection for allergy testing. C. Intramuscular injection of iron dextrin. D. Subcutaneous heparin injection. Answer: C. The Z-track method is used for medications like iron dextrin that can irritate subcutaneous tissue or stain the skin, ensuring proper intramuscular delivery. A patient becomes diaphoretic and lightheaded after a venipuncture. What should the medical assistant do first? A. Call emergency services immediately. B. Lay the patient flat and elevate legs. C. Apply a cold compress to the puncture site. D. Remove the tourniquet and needle, then stand the patient up. Answer: B. The patient is showing signs of vasovagal syncope. Laying them flat with elevated legs helps restore cerebral perfusion. The most critical step in performing a capillary puncture is: A. Warming the puncture site. B. Using the first drop of blood for testing. C. Choosing the most visible vein. D. Ensuring proper depth to avoid bone injury. Answer: D. Correct depth prevents both inadequate blood collection and the risk of bone injury, which could cause osteomyelitis in children. Which of the following best defines aseptic technique in a clinical setting? A. Complete removal of all microorganisms including spores. B. The use of alcohol for hand cleaning only. C. Practices that prevent contamination with pathogens. D. Sterilization of instruments only. Answer: C. Aseptic technique is not total sterilization but a set of practices to prevent contamination and protect patients during procedures. A patient on anticoagulant therapy presents with a nosebleed in the clinic. What is the first action a medical assistant should take? A. Apply firm pressure while leaning forward. B. Have the patient tilt the head back. C. Insert nasal packing. D. Place ice packs on the abdomen. Answer: A. Direct pressure while leaning forward prevents aspiration of blood and helps control the bleeding safely. Which of the following urine tests requires a clean catch midstream specimen? A. 24-hour urine protein. B. Random urinalysis for glucose. C. Culture and sensitivity. D. Pregnancy test. Answer: C. A clean catch midstream urine sample is necessary for cultures to minimize contamination by normal flora. The correct angle for inserting the needle during an intradermal injection is: A. 10 to 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: A. Intradermal injections are given at a shallow angle, 10 to 15 degrees, to ensure the medication is placed just beneath the skin. Which patient preparation is most important before an abdominal ultrasound? A. Emptying the bladder. B. Avoiding fluids for 24 hours. C. Fasting for 8 to 12 hours. D. Drinking coffee to stimulate the digestive system. Answer: C. Fasting prevents bowel gas that can interfere with visualization of abdominal organs during ultrasound. Which of the following is a primary duty of a medical assistant in infection control? A. Developing antibiotic treatment plans. B. Performing surgical wound closure. C. Ensuring adherence to standard precautions. D. Prescribing antiviral medication. Answer: C. Medical assistants are responsible for maintaining infection control through hand hygiene, PP, and standard precautions, but not prescribing or planning treatments. The best way to confirm correct patient identity before a procedure is to: A. Ask the patient their name and date of birth. B. Check the patient's room number. C. Look at the patient's appearance. D. Ask the patient's family member. Answer A. Verbal confirmation of name and date of birth prevents misidentification and ensures safe patient care. Which laboratory value would most concern a medical assistant and require immediate provider notification? A. Blood glucose of 120 mg per deciliter. B. Hemoglobin of 13 g/dl. C. Potassium of 6.5 milliequivalent/L. D. Blood pressure of 118/72 mmHg. Answer C. A potassium level of 6.5 milliequivalent/L is critically high and may cause life-threatening cardiac arrhythmias, requiring urgent attention. Which of the following vaccines is administered subcutaneously? A. Influenza, inactivated. B. MMR, measles, mumps, rubella. C. Hepatitis B. D. Tdap booster. Answer B. MMR is administered subcutaneously, whereas influenza, inactivated, hepatitis B, and Tdap are typically intramuscular. Which of the following is an example of a CLIA-waived test a medical assistant may perform? A. Blood culture. B. Glucose fingerstick test. C. Pap smear cytology. D. Wound gram stain. Answer B. CLIA-waived tests are simple, low-risk, and often done at point of care, such as glucose monitoring. A patient suddenly develops hives and shortness of breath after receiving an injection. What is the assistant's first response? A. Administer epinephrine if trained and authorized. B. Provide the patient with water. C. Wait to see if symptoms subside. D. Ask the patient about allergies later. Answer A. This is an anaphylactic reaction. Immediate intervention with epinephrine, if within scope and protocol, and emergency support is critical. When teaching a patient about wound care at home, the most important instruction is: A. Change the dressing every hour. B. Keep the wound dry at all times. C. Wash hands before and after touching the wound. D. Avoid looking at the wound to reduce stress. Answer C. Hand hygiene before and after wound care prevents infection and is the most essential home care instruction. Which of the following is the correct order of draw for venipuncture? A. Red, lavender, blue, green. B. Blue, red, green, lavender. C. Lavender, green, blue, red. D. Green, red, blue, lavender. Answer B. The correct order of draw is blue, coagulation, red, serum, green, heparin, and lavender, EDTA. Following order prevents additive cross-contamination. A patient reports taking herbal supplements daily. What is the most important action for the medical assistant? A. Disregard unless prescribed by a doctor. B. Replace them with multivitamins. C. Advise the patient to stop immediately. D. Document the supplements in the patient's chart. Answer D. Documentation is crucial since supplements can interact with medications or affect lab results, and the provider must be informed. Which of the following PPE is required when assisting with a patient on airborne precautions? A. Surgical mask. B. N95 respirator. C. Face shield only. D. Gown only. Answer B. Airborne precautions require an N95 respirator to filter small infectious particles such as those from tuberculosis or measles.